Great. Okay, well, again, I just want to welcome you to our Tobacco Free Tuesday webinar. We are extremely excited about this one because we're launching a new program today, June 1. You know, it just kind of came about the time we were having the webinar that it was also the day to launch, and we were doing it on Live Vape Free. So we're very excited for you to learn about the program, to promote the program, and to use the program. I wanted to introduce myself. I'm Gina Roberts. I'm with the Tobacco Control Program, and I'm the regional coordinator for the Southwest part of Virginia. And we have 5 regional coordinators throughout Virginia, and we have 2 that are on, we have 2 vacancies, and we have 2 regional coordinators other than myself that are on the call today. Nicole Mahan, she's from the Portsmouth Health District, and she's our Eastern Region Coordinator. And we have Sarah Burkhead, and she's going to be providing all the technical assistance today. She's from the Richmond Health District, and she's from the Central Region. And, you know, I mentioned earlier that we want this to be an opportunity so that you get to know our entire team. So most of us are on the call today, and they, you know, some weeks they will be and some weeks they won't, but I do want to introduce them. We have Jane Flowers, who is our fearless leader for tobacco control. She's our program manager. And we have Will Hockaday, who is our policy and outreach coordinator. And we have Rita Miller, whom you will be hearing more from today. She is our tobacco use and dependence treatment coordinator. And then we have Carolyn Halbert, who is our epidemiologist and evaluator for our team. So we are here to be your team too. So call on us. I'm Southwest, but that doesn't mean you can't talk to anyone on the team because we work together, and we would love to hear more from you. I wanted to go over just a few rules for the day. If you wanted to change your name, and I think everyone probably already knows this, but just click those little 3 buttons at the top right of your picture, and you can put in however you want your name to appear. Please keep yourself on mute. And at the very end, when we're doing questions, you can definitely come off to ask questions. And Nicole, I introduced Nicole earlier, she will be monitoring the chat box for questions. So please put many questions and input in the chat box as possible for you. So if you attended last month's Tobacco Free Tuesday, you know we started with the what's the tea question. What's the scoop on tobacco, so to speak. So our question today is, and I think it should appear to all of you very soon, is what is the most important aspect of a youth cessation program? And again, today's topic, Live Vape Free. Do you think it's peer support, you know, chat groups and such? Do you think it's parent support and involvement? Do you think it's healthcare provider involvement, asking about tobacco use at triage, or online and the texting component? And, you know, I think Jenny may be talking a little bit about this all throughout the program, Live Vape Free, but put the one that you think may be the most important aspect of our youth cessation program. And you'll just take a couple minutes. Okay, start finishing up. Just click the one you think is the most important, and we'll see the results. Okay. Do you have the results, Sarah? Oh, here we go. Okay. Okay, so we had 3 that were very online and texting component came out number 1, peer support, number 2, and parent support. And I understand that because, you know, it all works together, doesn't it? So this is, we'll definitely hear some more about that. Before I introduce Rita, I do want to kind of go over why we're doing the Live Vape Free. Why did this conversation even come about that we needed a program? So I just want to share very briefly a few slides to show the problem that we are experiencing. And many of you know it. I don't think this will be new information to most of you. The 2020 data may be new information, but I want to go over our slides. And of course, you know, e-cigs, and this is the very first slide, e-cigs or vapes have changed tremendously over a short period of time and are an ever-changing landscape. At one point, if you ask a teen if they vape, they would say no, but they juul. So, you know, Juul has become so popular with our teens now. Juul has actually become a verb. Do you Juul? Vapes not only look very different and often look like everyday products, they're also a variety of emerging alternative nicotine salt products and heated tobacco products. So you can see you have one that looks like the Apple Watch. You have those that look like flash drives, a necklace with a heart on it. And this is what all of the products right here are what our teens are using and seeing and very popular in today. So our next slide shows, you know, as you are probably very well aware, the rates of vaping among young people doubled in 2 years from 2017 to 2019. So 1 in 4 high school students reported current e-cigarette use. And this, you know, again, 2017 to 2019. And this is why the Surgeon General declared vaping an epidemic. And the sharp rise, you know, came also when Juul, you can see when Juul was put out there as a product, and it just shot straight up. However, I will say, and this kind of definitely surprised me, and this survey was shortened a little bit because of the pandemic. It normally runs from, I think, maybe February to April, but it shortened and ended in March this year. And this shows our youth tobacco use, e-cigarette use coming down. So from 2019 to 2020, you can see it had a 19.6% decrease, and with middle school, a 4.7% decrease. And you can also see, although with the numbers, and you can flip to the next slide, you can see that this resulted in a 1.73 million fewer current youth tobacco product users in 2020 than in 2019. So any tobacco product, and this is high school students, came down 23.6%. E-cigarette usage came down 19.6 use. The other tobacco products stayed fairly level, and you can see that on this slide. And then the middle school on the next slide shows pretty much the same data. The sharp drops in e-cigarette usage. So, you know, we're not quite sure whether this was due to the shortened survey period or T21 coming into effect or the ban on some of the flavored products. All of this could have, you know, an impact on why the numbers are going down. Unfortunately, you know, there are still 3.6 million youth that are currently using tobacco or currently using e-cigarettes. And the data shows that an alarming increase in the number of youth who use disposable e-cigarettes, and more than 8 out of 10 youth e-cigarette users report using a flavored product. So you can flip to that next slide. You know, and it shows that we still have an amazing concern out there with the disposable e-cigarette use surged in the past year. So it's still a concern. There's still work that we need to do. And that's why I'm so excited about this new program. And the very next slide, Sarah, we can always just show the Virginia data as well. And the Virginia data kind of parallels, and this is 2019 data, but it parallels what we're seeing nationwide with the rise in current e-cigarette use, the daily e-cigarette use, and any tobacco use, which the any tobacco use is being driven by that e-cigarette usage. So, you know, having showed you those numbers, and many of you are very familiar with that, I do want to kind of turn it over to the most important part of this presentation today, and where we can really showcase Live Vape Free, get you to promote it, get you to use it, and really be a resource for our parents and youth. I'm going to introduce again Rita Miller, and I've given you her title earlier, but to me, Rita is like everything cessation, okay? So if there's anything you ever need with cessation, you know, Rita is the person to contact, and she has been instrumental in getting this program to Virginia. So Rita, I'm going to get you to introduce Jenny and just talk about the process we've gone through.
All right, good morning, everyone, and I welcome you from the corner of Quitline, Virginia. And as Gina has said, yes, I am everything cessation to the tobacco control program. But as you all know, I am one who will help where I am needed. And so whatever I can do to support the work of the Total Tobacco Control Program, I am always here to do so. But this morning, we're here to talk about Live Vape Free. And as we all know, there's an e-cigarette epidemic among our youth. And although considerable progress has been made in reducing cigarette smoking among our nation's youth, the tobacco product landscape continues to to evolve to include a variety of tobacco products, which include smoked, smokeless, electronic products, such as e-cigarettes. However, we can take action and we must be aggressive and take aggressive steps to protect our children from these highly potent products that risk exposing a new generation of young people to nicotine. The bad news is that e-cigarette use has become an epidemic among our nation's young people, as Gina just showed us. However, the good news is that we know what works to effectively protect our kids from all forms of tobacco use, including e-cigarettes. So this morning, the Tobacco Control Program is delighted to have each of you on this webinar as we learn about the latest addition to the Quit Now Virginia services, which is Live Vape Free. Live Vape Free is a teen and adult solution to help solve the vaping epidemic. The program is grounded in more than 35 years of physical, psychological, and behavioral health science from Optum, which is Virginia's quitline provider. So as Gina mentioned, we are extremely excited and very pleased to announce that Live Vape Free does launch today or has launched today here in Virginia. And to help us get off to this great start, our presenter today is Jenny Klein, who is the Senior Account Manager with Optum. Jenny has over 15 years of sales, account management, healthcare marketing strategy experience, 7 of those years with Optum. From launching a new hearing aid line in Costco stores to managing over $25 million in funding for tobacco cessation, Jenny's passion lies in strategy and healthcare. Recently, Jenny has been involved in product development and the rollout of Live Vape Free, a vaping cessation prevention and educational program for both teens and adult advocates of teens. Jenny graduated from the University of Washington with a bachelor's degree in business administration and currently resides in Walla Walla, Washington with her husband and 2 children. So please join me in welcoming Jenny and thanking her for waking up and getting up so early with us this morning, because as we know, Washington is a ways away and they're in a different time zone. And so she's up early to be with us this morning. So I am going to turn things over to Jenny and let us welcome her. Jenny?
Good morning, everybody. Can you guys hear me okay?
Yes.
All right. Well, thank you, Rita, for that very kind introduction. I am thrilled to be here today, and it's so fun to be here on the day that we're launching the program. So today is very exciting. I know last night I had some butterflies in my stomach, but everything went well, and we have officially launched Live Vape Free to Virginians beginning today, which is so exciting. So I'm going to take you through what it is, what we're trying to accomplish, why we developed it. And then at the end, I already have some questions from you guys, so thank you for submitting those in advance, but we'll definitely have some time for Q&A, along with going through how we can get this program out there. How can we promote it to really help make a difference? So as mentioned, Live Vape Free, it is a teenager and parent solution to solving the vaping epidemic. Now, that word parent in there, it kind of bugs me because actually it should say parent / guardian / concerned adult / school counselor / coach. But that just didn't really look good on the slide. So I am calling it parent, but please know that it really encompasses any kind of a concerned adult in a teen's life. So somebody that can be an advocate, can be a trusted adult that could provide support and help with the conversations with the teens. So again, you'll see parents throughout the deck, but please note that there's a lot of backslashes after that. Okay, so first we'll get into the introduction itself. Then we'll kind of get into the umbrella bird's eye view of the solution. Then we'll break it down into the adult program and then the teen program. And then we'll get into promotion and Q&A. So kind of echoing, Gina's sentiments around the vaping epidemic. We know the Surgeon General's report has called it an epidemic. We have 19.6% of high schoolers reported nicotine vaping in 2020. And I have a thought, and it's a hypothesis, Gina, but I know that the numbers went down. I think what makes me nervous is I think as we open back up, I'm nervous that they might go back up. My hypothesis is maybe more teens were at home, where maybe they didn't have the independence or autonomy to vape. And so I'm really hoping, again, we can get these prevention and cessation programs out there to keep the numbers going where they were going. But here we are in 2020, 4.1 million. That's what that 19.6% represents. So 4.1 million of high schoolers have reported vaping. And then this third statistic I think is kind of interesting. So 44% of teens reported that vaping is deemed socially acceptable versus 23% reporting that, combustible cigarettes are socially acceptable. So I have huge air quotes here, but I mean, it's become the cool thing to do, and it has become more socially acceptable than smoking itself. So we have to act now to protect the health of our nation's young people. Moving into that, the concerned adult or the parent side of things, I think there's an opportunity to support that group as well. We know a third of parents have reported being concerned about their children vaping. 36% of parents have no awareness of e-cigarette brands, so they aren't sure what they look like or the brand names. And 49% of parents are aware that certain e-cigarette brands contain nicotine. I think that goes with the teens as well. I don't have a stat to back that up, but I think in general, the concern is there's just so much unknown. Teens don't know how much nicotine they're getting or that there's even nicotine in there. And then the same goes with the parents. So let's get into kind of the bird's eye view of Live Vape Free itself. So when we sat down and started thinking about what we wanted to create and how we wanted to be a part of the solution, we created this vision. So this was really one of the first things we developed in the product development, and making sure that every aspect of the program kind of comes back to this vision. I won't read the entire thing to you, but I'm going to read the first couple of sentences because I think it'll help hone in on what we were trying to capture with our vision. We will not capture the hearts and minds of teenagers with criticism and consequences for vaping. Let's instead make it a conversation, letting teens be a part of the solution. So I think those two sentences kind of scale in what we are wanting to do with Live Vape Free. And as I go through the different product aspects, I'll kind of tie it back to this vision. So here's the bird's eye view of what Live Vape Free encompasses. So the left-hand side, you'll see online courses. So those are self-paced learning experiences designed to turn parents, guardians, and adult advocates into quit champions. So it's not a cessation program for adults, rather it is an educational program for adults. We want to support them, and I'll get into the details of each of these programs and how we do that. So the middle part, or the meat of the program, is our text-based action plan. So interactive texting and meaningful content to guide teens to behavior change. I thought that the stat or the survey we did in the beginning was interesting. And I think that was something we knew in product development, that we wanted to approach teens in a modality that they would actually use. And so that's why we've created this. It isn't everything is done through texting for the teen program. And then lastly, we have coach support. So we have coach support that is available through chat and text. So we modernized it a little bit. We have fantastic quit coaches. They're tenured, they're experienced, they're trained. We really do believe in the human component of behavior change, but we wanted to modernize how accessible they were. So rather than relying on the telephonic approach, which we know teens don't, wouldn't really want to talk on the phone, we've modernized it to make it available via text and chat. All right, so let's get into the adult program. So again, this is an online course that is designed to turn concerned adults into quit champions. So as Rita said, we are the service provider for Virginia, and so we get a lot of calls to the quit line. And we find that we've gotten a lot of calls from parents or concerned adults that kind of fall into two phases. The first phase is they want to have a proactive conversation with teens, and they aren't really sure how to do that. So maybe they know some of their teens' friends are vaping, or they don't think that their teen is vaping, but they want to have some dialogue. They've obviously gone to Dr. Google, but they're looking to us as more of an expert. And so they've called the quit line to see what they can do to help support, have those proactive conversations. And then there's another phase where we have parents that call in that either suspect or have found a device and they aren't sure what to do with it. Or they know their teen is addicted, the teen knows they're addicted, and they just aren't sure how to get them the resources to help them quit. So when we created these online courses, we took into consideration both of those phases, both kind of the proactive approach, the educational side of things, but then also, really helping turning these adults into quit champions and allowing them the resources that they can have those conversations and begin the dialogue and be advocates for their teens to help quit. So I went off on a little tangent here. So let's get into the slide itself. So again, these are just some examples of lessons. So lesson 1, it'll focus on the risks of vaping nicotine, its health effects, and what teens and parents are saying about vaping. It covers the array of devices like Gina had, what they look like and how they work. And we've built this to be extremely agile. So on a quarterly basis, we have a clinical team and our product team reviewing the content and making changes. We know that this space is moving really quickly. Technology, innovation, unfortunately, they're moving quickly. And so the array of devices, I'm excited to say, will be reviewed quarterly, and any new devices will be added. And I think that's an important part of this program is we didn't build it to be stagnant. We know it had to move. We knew it had to continually change content to stay up to date. So I am excited about that feature is, when the parent gets in there, the array of devices will be the most up to date. Another example of the lesson 2, providing practical advice for parents on how to talk to their teen about vaping. So this is a really big part of the program. So this is just one lesson, but it really is in a lot of lessons. We didn't build this to come from a reprimand angle or a critical angle or a punishment angle. There may be a time and a place for that, but we really did not develop this with any of that in mind. We developed it to help conversations happen between the adults and the teens, to help provide the materials for the adults so they feel informed and have the resources that they can really help the teens become a part of the solution by having those conversations with them. So we wanted this entire program to really be about helping the teen quit, but doing it in a way that is educational and a resourceful, not coming from, really a punishment angle. So you can see on the right-hand side here, I think right now we're in a fact or fiction, flashcard lesson. I'm going to go to the next slide here and you can see, so all of the lessons are in different formats to really try to keep it fresh and, keep it interesting. So we have videos, we have discussion forums. Those discussion forums are all monitored by our coaches. they, we've had a soft launch in some states already with the parent side of things, and we're seeing some great discussions occur between parents and guardians. And again, the Quit coaches are there to support. There's journaling built in, there's polls, interactive exercises. And so what can happen is when you log on to this online course, right, it's kind of fuzzy, sorry about that, but you can see over here, okay, I'm going to do the fact or fiction quiz. I'm going to look at the video, Vaping in America. Oh, I have time for the flashcards. I'm going to go through that. Oh, you know what? I don't have time for anything else. It's a save as you go program. So they can just close the laptop, be done, and come back whenever they see fit. Or, they can pick and choose what they think would be the most applicable for them. I mean, obviously, we would love it if they would do all of the lessons, but again, it's not built that in that restrictive way. You can really pick and choose, you can go through. Now, we will make recommendations based off of some of the assessments, but in general, it is designed to really allow the flexibility and really, help with the time management of it. You can also go back and review any other lessons at any point that you've already viewed. So also on the, and I'll get into it, the URL, livevapefreeva.com, there is a downloadable toolkit. And what I love about this is this actually is available in the site itself prior to even having to register. And we did that intentionally. It's kind of like our public service. We want teens to quit. And so this vaping discussion guide is available at that website without even having to register. So we're kind of seeing this as, you can use this as maybe a promotional tool, but really so I'm a child of the 90s, and I used Cliff Notes a lot. I don't even know if Cliff Notes exist anymore, but this is kind of the Cliff Notes of the online course. It really allows people to go through, kind of get a little nuggets of information, but obviously we can use it to promote when they want to go deeper, when they need more. So I am excited about this downloadable toolkit that is available. Furthermore, we have chat support for the adults or concerned adults. So at any point throughout the program, you'll see there's a chat with a coach button, and they can press on it and ask an FAQ, a one-off question that maybe they're not finding the answers to. And I'm just really excited about the kind of the modernized way that they can have access to our fantastic Quit coaches. So again, these are Optum coaches who are already trained on the terms, they're trained on vaping, and they're trained on dual use. They leverage their experience as a coach to really help concerned adults become advocates. And then the chat library helps facilitate conversation in kind of a consistent and evidence-based manner. So I'm excited, and that is available 24/7. So our coaches are there 24/7 whenever they'd like to chat with a coach. So that really kind of sums up the adult program. I really think this is a key part. We wanted to provide a full end-to-end program, and I think that we know that when teens want to quit or know they need to quit, sometimes they won't know what to do, right? And so sometimes maybe it's not a parent, but maybe, like I said, it's a coach or a school counselor. Can really be there. They'll have the resources, they'll have the information from the online course, and then they can also recommend, to the teen to enroll into the teen program. So we actually have built at the end of the adult program, it will also promote the teen program, so that if a teen comes to them, they can say, hey, text Vape Free VA to this number and you're good to go. You can go through the full program via text. So we're excited about this component in the program for Virginia. All right, so let's get into the teen program. Like I said, this is kind of the meat of the program, or if you're a vegetarian, maybe like the mushroom of the program, like really kind of the center core part of the program. So it's designed for teens, and it's interactive texting. It guides teens to behavior change, and helps quit vaping. So before I actually get into the slide itself, I'm going to take a step back and just kind of explain what it is and why we built it. So we were a little later to the marketplace than a couple of other programs out there, which it can be good and bad depending upon how you look at it. But the way we looked at it is, okay, we can learn from what's working, and then maybe, build upon that. So there's a program out there that is a semi-tailored text experience. So it's literally, they're going to send text messages to teens. It's not a human, it's a semi-tailored automatic text messaging program that can take them kind of start to finish. It's not adaptable, but it does provide good information. But we've heard feedback from that program that they wanted access to a person. They wanted a little more customization. It felt a little bit not personal, if you will. So that's fine. And then there's another program out there that is only text with a coach. And we were excited about that program, but then we started hearing that, surprise, surprise, teens tend to ghost coaches quite a bit. It was hard to move teens along the quit continuum because the only reliance they had was to try to engage with a real person. And so it was difficult to keep teens engaged in the program. So when we kind of analyzed this, we thought, well, let's kind of combine those, right? And then build upon it. So what we have here is a full texting experience. We have built in 5 kind of personas. So we have a couple assessment questions in the beginning, and then, we're going to kind of identify those individuals into maybe a persona. So what I mean by that is we have LGBTQ representation, we have different race representation, we have obviously female, male representation, we have 13-year-old representation, 17-year-old representation. So those personas are all built into our program. And so it does feel more personal. It is not going to be the exact same text messages for every individual. It's really going to be based off of the assessment and where they are in the quit continuum. So we're going to send text messages out to them based off of an algorithm, which I'll get into. And then beginning August 1st, I'm so excited because we are also going to have access to a coach. So at any point, the teen can text, hey, I need more help, or hey, can I text with a coach? And one of our quit coaches will be right there, ready to text with them. They can go through a full intervention. They can go through just Q&A, but the program isn't reliant on that. Rather, it is a supplement for those teens that may want that engagement, which I'm really excited for. So let's get into the slide. Sorry, I get all over the place. So a learning experience for teens ages 13 to 17 that's fun, easy to navigate, and teaches the skills to quit vaping for good. The program itself has an authentic voice. Okay, I'm going to pause on this bullet. Again, a little bit of a tangent, but stay with me here. I'm going to go into the weeds, but I think it'll make more sense once I get into it. We have partnered with an organization called Impulse, and that organization has a lot of experience in texting wellness programs, and they utilize what they call NPL, natural process language. You don't need to memorize this, but stay with me. And what this NPL does is it allows the AI to understand intent of text messages. So rather than having a little bit more of a stagnant text message where it's like, yes, no, okay, coach, rather than that, it's more natural dialogue. So a teen could send an emoji, like maybe our text message says, okay, yesterday was your quit date, how's it going? Sad face emojis with the teen text back. The program can pick up on that and say, okay, we all have hard days, here's some recommendations. Or let's say the teen says, hey, I need more help. The program is designed to say, it sounds like you would like to text with one of our quit coaches. And so, is that the case? And the teen can say yes, and then we'll connect them with a quit coach. So what I'm really excited about is that it isn't it isn't stagnant, and it can really pick up on the intent behind the text message rather than just having these kind of yes, no answers. So that's what I mean behind authentic voice, along with, like I said, those personas. Okay, second bullet, little to no barriers. This is one, I know there's an epidemiologist on the phone. This is one that we've gone back and forth with our evaluation team, but we've really tried to limit those registration questions. We don't want there to be a lot of barriers to get in the program. We want the teens to be able to answer a few questions and get right in. And so I think we've landed in a nice place where we're capturing, first name only. That was actually focus group based, that was more comfortable for teens to only provide their first name. We are capturing gender identity. We are capturing a few assessment questions, and then they're in the program, which again, I'm really excited about. So it's not going to be a long process for them to get enrolled. The third bullet, multimedia experience. So I actually will get into that in a couple of slides, but really we've built, it's a text messaging program where we're sending different media experiences to them through a URL that will link them into different types of media, which I'll kind of get into. The fourth bullet, easy to access content that educates on the keys to quitting, motivates, inspires, and enlightens. I think that's also a really important and key part of this program. Again, we're not coming from the punishment reprimand angle. Rather, we're coming from we want to motivate, we want to inspire, and we want to enlighten you. So help teens find their why. This one, I'm going to pause on it again. So I'm excited to say that we actually did a lot of focus group testing on all of our content. We had focus groups that contained of or comprised of 13 to 17-year-olds. So it truly represents the market that this is for. And what we found was educating teens on big tobacco, the predatory nature of big tobacco, the fact that they look at teens like dollar signs, and just kind of the social injustice side of big tobacco. A lot of teens in our focus groups use that as their why. Once they were really educated around it and understood that they're being targeted, they didn't want to be a pawn. And so I thought that was so interesting and really exciting, honestly, that once we educated teens around that, a lot of teens use that as their why they wanted to quit vaping. Now, not all of them. There's a lot of other reasons where they might want to quit, but that was the main one. We want to boost their confidence. So we want to make sure that they feel confident, again, that they have the resources to quit vaping. And then this last bullet, cadence adapts to teens' engagement. So again, this organization that we've partnered with has developed an algorithm that sends text messages out to the teens. If the teen is really engaged, that's fantastic. We are going to keep sending those text messages that include all of the lessons. And we will send them at a pretty frequent pretty frequent timing. If the teen isn't as engaged, or we're seeing that they are maybe not opening the lesson up, or they're opening up the lesson but not responding, that's okay too. We're actually going to kind of scale back a little bit. We're still going to send lessons. Don't worry. We want to move them along the quit continuum, but we want to do it at the pace that feels comfortable for them. And we've learned through focus groups that if you're kind of bombarding a teen that isn't really there or isn't engaged, a lot of times they'll opt out. And so I'm thrilled about the algorithm that kind of can adapt the cadence of when we send the lessons. So that's a part of the program as well. Okay, so how does it work? So it is a text to enroll, which I'll get into that side of it, but the teen will text vape-free VA to a short code, and they'll immediately receive those few brief questions. So it is all done via text. Upon enrollment, the texting experience kicks off with the first introductory lesson to kind of assess. And again, that's where we're going to kind of assess maybe what persona will fit the teen. Then the teen will set a quit date. Staying engaged. So again, the teen beginning August 1st, the teen will have full access to our Quit Coach team, and they can, do live texting with a coach. They will be responding to incoming texts from the teen. And then we will also be continuing to move them along with those semi-tailored text messages. So they'll be receiving those, videos, quizzes, podcasts, etc. Achieving success. So this is going to be a little bit different than how we measure tobacco. It's okay if it's just a little bit different. So once the teen has reported being vape free for 7 days, fantastic. We are going to switch the messages over into relapse prevention. We want to support the teen and really help prevent a relapse. So at 7 days, that's where we're going to switch our messaging. And then once the teen has reported being vape free for 30 days, fantastic, that's when they graduate from the program. So we're really excited to have them graduated from the program. There's several congratulatory texts, and that's that. If for some reason the teen relapses, of course, they can always re-enroll into the program. So if you guys remember a couple slides ago, I said multimedia experience. So again, we are sending these text messages to teens, and they include video, links to videos, links to quizzes, links to self-assessments, flip cards, audio podcasts. I was going through testing last week, and the teen text in that they were having an urge, and our program sent them out a live feed to a panda viewing, just to kind of try to sidebar. So it's really kind of fun content that is evolving. So it's really similar to the parent program. We are going to be monitoring the content quarterly. We are going to be adding more content continuously. It was built to be agile and to adapt. So we may even be adding more media as we get going. These are actual images of the program itself. And so here's why I'm quitting. So it's different videos of the different individuals. These are actually the 5 personas that I talked about. Here's kind of our first assessment question. How addicted are you? So you can kind of see what it looks like in the program itself. Here's a few more. You can see what the different media types look like. So again, we're sending a text message with a link, and that will move them into, the content that we would like them to view and to help support them. You can see on the right-hand side here, once they click in, they will immediately have access to a lot more content. So if they're engaged, great, they can go to a new beginning. I know it's small, I'm going to read them out here. Asking for help, battling the big 3, quit vaping for life, brighter days ahead. So they can go on and view content if they're extremely engaged. If they don't have time or they aren't interested at that point, great, they can do the lesson that we sent them, and then we will continue to send them different lessons as we're moving them along the quit continuum. So that really is the program itself. We are so excited to launch this in Virginia. I think that it is time that we put an end to this vaping epidemic. So how do you actually get into the program? So I've kind of broken into 2 parts here. This is a little bit more of a copy paste if we're promoting it, but enroll today in a free teen vaping text program by texting Vape Free VA to 873-373. So again, you're just texting Vape Free VA to this number right here, and the teen will get started. Or the same thing for the parents or guardians, enroll today in livevapefreeva.com. That will take them to the page with resources, that downloadable guide. They'll then click on Virginia, and then they can get enrolled to get those resources. I did a little short code summary down here. Teens, text Vape Free VA, and concerned adult, go to that website, just to kind of shorten it and make it easier for everyone. Okay, so Q&A. Again, I appreciate some of you sending these questions in advance. And so I'm going to walk through these questions. And then at that point, Nicole, I think we can go through whatever questions may have popped up in the chat. And yeah, I'm excited to hear some feedback on what you guys think. So the first question that came in is, do parents have to give consent to those under 18? Great question. No, they do not. So this was built as an educational tool. It is not built as a treatment tool. And so the difference between those two is consent. And so because it is educational, parents do not have to give consent to those under 18. Furthermore, we will not be sharing information to anybody that calls the line about who is enrolled. I know people could probably look at that both ways, but we have created the fine line that we want this to be a comfortable space for teens to enroll. We wanted them to feel safe and feel like they weren't going to get kind of told on, or if you will. And so anybody that calls the line or interacts with the coach will not know what teens are enrolled in the program. With that said, though, at the end of the program, when they do graduate, like I said, there are several teen graduation text messages. And so, we're kind of trying to think through maybe if there needs to be for a school district like proof, we might work on that. And I think that's something maybe we can work with Virginia on. Okay, so that is the answer to that question. The second bullet, parent tips for talking to teen. If parent is a smoker, vapor, and supports use. Yeah, that one's a difficult one. That is a really difficult one. I think in general, we do not have content built into the teen program around if their parent is a smoker, vapor, but that is something maybe I can provide some content. Some feedback to our clinical team to add some content on that. I think then this one would have to really be reliant on other adult advocates in the teen's life that may, be there to encourage the teen to quit. I think that is, a difficult situation to handle. So I think that's a good question. I love it. I think I'll provide some feedback to our clinical team if maybe we need to include some content for the teen on if their parent is a smoker as well. Okay, so the third bullet, how is cessation different for vaping versus traditional tobacco products? How is it different for youth versus adult? Really good question. So kind of the first question, overall, it is all evidence-based. So it really is, it's not different other than some of the language that is used. We are still really working through the 5 keys of quitting. We're still wanting to make sure that we are using the behavior change, kind of the roots of the behavior change of our program to help teens quit. So I think some of the language is different, but again, it's really rooted in the evidence-based behavior change program that we've had in Quit Now, Virginia for years. But really good question. And how is it different for youth versus adult? And again, I think this is one where the program itself uses a lot more casual language. It motivates, enlightens, and inspires. We're using emojis. We're trying to, we really relied on that focus group to make sure we hit on content that resonates with youth versus the adult itself. We don't talk about NRT or nicotine replacement therapy at all throughout this program because we do not have NRT available for under 18. And so that also is a little bit of a difference. But I think that's a really good question as well. So hopefully that answers the 3 questions that came in advance. Nicole, at this point, that opens us up to other questions that may have come in from the chat.
Hi, thank you so much, Jenny, for that great overview of the new program, Live Vape Free. We're very excited, and as the chat has shown, a lot of people are excited for this program too and take use of it. I did have a question, not sure if this is for you or Rita, but Amy Polson asked, if they do a local campaign to promote this program, would it be possible to get information on the total numbers pre and post campaign from the targeted zip codes to see if the promo was successful? I don't know if we do we collect that
Yep,
data?
yep. So I can answer from our side of things. And then, yep, Rita, feel free to jump in. So we do collect zip code. So that is one way that we are identifying where the participant is at. So we can provide that reporting. There is reporting available for enrollment. Obviously, lesson views, time in different lessons sent. And then once that coach piece is available as well, all of the interactions with the coach will be available. And then we can dial it into the zip code because we are asking the teen their zip code.
Great, Rita, do you have anything to add to that, or did Jenny kind of cover all of it?
I'm sorry, Nicole, what was your question?
Did you have anything to add to Jenny's response, or did she cover
Actually, I really don't. Let me get myself on here. Actually, I really don't, because I responded to Amy and I said that we'd have to refer to Optum on this, because I know they would have to be instrumental in making that happen. So Jenny has answered that for us, so we'll go with that.
Yep.
Hey, all right. Our other question comes from Pam Ray from the New River Health District. And she says that she works with a lot of parents who are trying to learn more about prevention for their middle schoolers. So are they able to access this information?
They are, yes. So there is no restrictions on the parent adult advocate side of things. So I really encourage, or Pam, I guess I can just talk to you directly. I'd really encourage you to get that link, the livevapefreeva.com out there, and they can definitely enroll. There are some laws around texting under 13, and so that's why we've restricted the teen program itself to 13 to 17, is because of texting with the youth. Obviously, our legal team, we had to go through quite a bit. And so once we learned that we really couldn't go below the age of 13. But with that said, I think that's a fantastic way to provide support for the middle schoolers, is to have those adult advocates take the adult course, and they can have those resources to really have those conversations.
Great. And Lindsay asks, is there any follow-up to see if completion of the texting program prevents initiation?
Texting of the, I'm sorry, can you ask that again, Nicole,
Yeah.
or maybe whoever asked it? I'm not sure if I'm following.
Yeah, so Lindsay asks, is there any follow-up? So I guess, has the program been around long enough to see if this prevents youth from initiating tobacco use as well?
Oh, I gotcha. On the other side. You know what? So we are launching today. Virginia is one of 8 states that are launching today. And so I am so excited to get some teens enrolled into the program so that we can really start getting that feedback. But at this point in time, it is so new that we do not have any kind of research or evaluation on that side of things yet. But I'll keep you guys posted as we get more and more numbers.
Oh, I'm sorry. So Lindsay clarified. She asked if there's any plans for follow-up. As you just said, you'll let us know. So hopefully,
Yep.
This launch today will encourage more people to enroll, and we can get some information for that. And Will asks, after 30 days, is there a seamless way to opt in and continue receiving messages without re-enrolling?
Yeah, so if the participant actually reports being quit for 30 days, we do graduate them from the program. And so upon re-enrollment, the algorithm itself will pick up and will say, welcome back. Name, but then we do go through those assessment questions again, mainly because things could have changed. It could have been 2 years. And so we do go through those assessment questions again, but it does recognize that it is the same phone number that has already gone through the program, and it will welcome them back to the program. But then once they are graduated from the program, we do not send out text messages any longer until they initiate again.
Jenny, can I add, how did you come up with the 30 days to consider that a good time frame to drop the messages?
Yeah, good question, Sarah. So we really went back and forth with our internal evaluation team. And when we were trying to figure out how we wanted to best evaluate this program, we leaned on kind of what's out there already. And being 30 days quit vaping is what is considered to be quit. And so that's why we decided that the 30 days would be kind of, and again, we're sending relapse prevention from that 7-day all the way through to the 30-day. And the teen does need to respond to us that they've been 30 days quit for us to fully graduate them from the program. And so it was really based off of dialogue with our clinical and our evaluation team. Good question though, Sarah. Yeah. But like I said, we won't neglect them. We're sending relapse prevention all the way through. And then the teen does need to acknowledge that they have not vaped in 30 days for them to graduate.
And Alicia, I think it's a question for one more, or time for one more question. And Alicia asks, are there any resources on the website that we can use to promote the program further other than the link? And I don't know if that's a Jenny question or Rita and Will, if we have something in the works for that.
Yeah, I'll go first, and then Rita, I'd love it if you could jump in. So we are in the process, again, we're so excited to get this launched today. So we are in the process of creating different promotional materials that I'm sure we will keep you guys posted on. And that's coming from the Optum side of things. So I don't know, Rita, if you want to jump in from the VDH side of things.
Yeah, certainly. We're working on getting all of our tools and resources together to get up on our website. But the exciting thing about this is we will be working with youth advisors from the adolescent program so that we can also do promotions on social media. But we wanted to hear it from the voice of young people in order to do that. So we will be creating those over the next couple of weeks, months, so that we can get that up as well. So we're trying to get a plethora of things developed so that we can promote Live Vape Free. And while I'm here, I'm also, and I appreciate you, Jenny, leaving this slide up, because I really want all of our participants today to take down these websites and these numbers and use them in the communications that you have with your parents, your teens, organization partners, whomever, because this is a program for the entire state of Virginia, for all of our young people, for the parents, anybody who is connected to vaping in any kind of way. And so in order for our young people and parents and those who are advocates of our young people to know that this program exists, we have to tell them. And so we have to rely on one another to get this information out. So I would appreciate it, the entire team would appreciate it, if you would take down these numbers. In any kind of correspondence that you send out, just put a little blurb in that they can send their constituents, whomever they may be, to Live Vape Free. And also, as you know, this is going to be recorded, and so we'll let you know when the recording is ready, and you can share that as well. Thank you.
Thank you so much, Rita and Jenny, for the answers to those questions. I know we're coming back. I'm close to time, so I'm going to lead it, pass this back on to Gina Roberts to close everything up.
Great, thanks, Nicole, and thank you, Jenny. That was an excellent presentation. And again, I'm so excited to really launch this program and get parents, teachers, youth really involved in really spreading this around. So thank you so much. Now we're going to return to the tea for just a minute as we're wrapping up, because we're curious to know if this presentation has changed your thoughts on our first initial question. So we're going to see the what's the tea question come back up with what is the most important aspect of a youth cessation program. And we've talked about a lot of this here today. So look through there and see if it changes. It may not have changed your original thought. You know, we had 3 that were pretty much tied for first, with online texting being first at the beginning. So take that 10 seconds and look that over and choose your answer. Okay, Sarah, do we have results? Okay, online and texting component. And I know Jenny went over that in detail at this, and that's what they're really relying on very strongly to interact with the youth. So that's great to see. We are, again, very excited that everybody joined today. Use the website, use the promotional materials once they come out, and promote this out there. Thank you for joining us today for our Tobacco Free Tuesday. Our next month topic will be on FDA's ban or proposed ban of menthol. And I know that has been in the news lately, and we really want to delve in and really find out more details and how that will impact maybe the work in Virginia and what we're doing. So thank you so much. I look forward to seeing you next month. Promote our webinar too, and enjoy your week. Thank you so much. Bye.